Hello everyone, myself Himani Sharma from RPIIT campus. In today's class, I discuss about the definitive therapy of the hyperthyroidism gravis disease can treat for the 12 to 18 months with the methimazoles, after which about 1:4 with go into the remissions and be able to come off the methimazoles. Continue thiamides long terms less likely to consider this in young points. Radioactive iodine therapy destroys thyroid tissue. Majority end up needing thyroid replacement. No to exacerbate the thyroid eye disease. Surgical research consider if point has large nodules, particularly if the nodules have concerning the features on U by S. MNG or the solitary nodules would not go into the remissions. Thus consider the definitive therapy with RAI surgery. 72 young mother which the CAD cardiac arrhythmia treated with the amiodarone and now with the thyrotoxicosis undetectable. Initial evaluation to help the determine if the point has the amidarones induce the hyperthyroidism type 1 versus 2. Look for the thyroid eye disease, thyroid nodules, goiter, check the TRAB for underlying graves and U by S to look at the architectures, nodules and evidence of the thyroiditis. Type 1 amidarone induced hyperthyroidism. Type 1 likely secondary to the large iodine load on a pre-existing state of thyroid disease, graves or nodules, ongoing thyroid organifications and thyroid hormone synthesis may see increased vascularly on Doppler. The Doppler and the thiamide therapy will help the control levels. Type 2 the destructive thyroid toxicosis from either the iodine or the drug itself. Thyroid is not making more thyroid hormone but releasing the performed thyroid hormone. Steroids are best therapy. If history P and evaluations clearly suggest the AIT-1 or AIT-2 treat with the methimazoles or steroid respectively, often it is the challenging to distinguish between the AIT-1 and AIT-2 or the fairly sick requiring timely intervention. Methimazoles 40 mg and the prednisones 40 mg daily, if respond quickly, suggests the prednisone is the, the predominant therapy that is working and thus can taper the methimazole down and potentially off. Amidarones can affect the thyroid for several months. There are 45 young female present with the fatigue and weight gain, dry skin, hair. TSH is 40, FT4 is the 0.45. How do you treat her? Levothyroxines 1.6 mcg per kg. Usual weight based the estimation start lower if there the cardiac disease older, the 25 to 50 mcg daily. Take apart from the food or the meds morning, but HS will work too. If the TSH was the 6, FT4 normal, and could check if the TPU anti-microsomals and if positive where would be the consider starting the LT4 25 mcg daily if the point had the symptoms of the hypothyroidism. 43 per year. In today's class I discuss about the following induced disease, that is the amidarone induced hyperthyroidism. Thank you for